Hi, I'm Ed Roth from Shine's Medicare and More program.
And I'm Carrie Free. I'm the Assistant Director of the Central Mass Shine. Welcome back to Medicare and More.
Today, I'd just like to talk a little bit, very briefly, to give folks an update, folks in the disabled community, folks that are under 65 and have a unique new program, One Care program, where they get their services, the same services they get from Mass Health and in Medicare. It's provided in this One Care program. Carrie, you want to talk a little bit about the termination of Fallon Total Care?
Sure, I'd love to. One of the things we want to make sure that people are really clear about, and why we wanted to have a little separate video about this, is that Fallon Total Care terminated officially the last day of September. With that said, if a person did not make a choice, like if you didn't make a choice to go into a Tufts plan, because Tufts also has a One Care plan, then everybody was just going to revert back to having original Medicare, having full Mass Health benefits, and everybody, unless you made a choice, was going to be put on a Humana prescription drug plan through Medicare. So that's good in that everybody will have drug coverage and that nobody will be lost. There are some pitfalls with this, though, that we wanted to make sure that everybody was aware of. The Humana plan is obligated to cover everybody's medications regardless of what that medication is for the month of October. So month of October, everything's going to seem smooth. You're not going to see any difference in your drug coverage. The problem is probably going to start in November. In November, Humana is now going to revert back to their regular formulary. So what that means is they're going to go back to the drug list they had before October. So October, everything's going to be smooth, you're getting your medications as normal, no problems. But then November, you may find that Humana doesn't even cover some of your medications. That is going to be a problem. So that's why we want everybody to know about this, because the best thing to do is to figure out which of the drug plans through Medicare would be the better bet as far as covering your medications. People will still have the subsidy, you'll still have the same copays you have on the Mass Health. The problem is, again, are the drugs on the formulary for the drug plan or not? So that's why we really want to make sure that people are checking this out, because as of November, you might have a problem filling with some of your meds. And there might be limited assistance in helping to pay for those medications because, again, the drugs just aren't being covered by the plan. It's not that you don't have a drug plan. It's not that you don't have a subsidy. The drugs are just not available on the plan. So that's a little bit of a problem that we're very concerned about. So that's why we wanted to make a little video about this. So people can feel free to call us about what's the best drug plan to go into. You can call Medicare and give them a list of your medications. Medicare is open 24/7, and you can give them a list of your medications and they can review it for you. The Massachusetts College of Pharmacy can also do that and research drug plans for folks. So there's a variety of us that can do this for individuals. We just want to make sure that people become proactive, because if you have a problem in November, we probably can't fix it until December. So just a big warning out there. Ed, anything else you'd like to add to that?
That's about it, Carrie. And we just want to make sure that folks understand that that Humana preferred plan, we've run some drug searches for folks, and unfortunately, some of the medications that they're taking are not on the Humana preferred formulary. And if that's the case, that drug won't be paid for by the Humana plan in November. So we want to make sure that you, again, your drugs are covered, and we've been able to find plans in most cases where the medications are covered in other plans. And there might be a situation where the medications are not covered in any plan. And that can happen too, and that's another situation where we're going to have to try to help you find an alternative, talk to Medicare and intervene on your behalf to see if we can get a plan that will cover your medications. But again, it's not the end of the world, and this is particularly for those folks who were on the Fallon Total Care plan, went back to original Medicare and Mass Health for their coverage, and also received a drug plan card from the Humana preferred drug plan. So this is the folks we're talking to today, and we want to make sure that you're getting the coverage that you need. That's our main emphasis here. And again, that's what we're here for. We want to help you, and we're particularly talking again to those folks that are disabled between the ages of 18 and 64 who had the Fallon Total Care Plan and reverted back to Mass Health and Medicare. So if you're in that situation, you're watching this little video, little clip, give us a call, and we'll be happy to discuss your options with you, okay? And again, thank you for listening. Thank you for watching the clip, and we look forward to helping you out. Bye-bye.